Yes. Okay. Good evening. Welcome. And how are you doing? Welcome to another session, brief live session tonight. And today we'll be talking about Galactorrhoea. Now, I have a guest joining me today on this program. For the ladies that have been complaining about, oh, I have milk coming out of my breast, I have whitish substances coming out of my breast. We have a guest today, and our guest, some of us know him. He's a consultant obstetrician and gynecologist, works at the ERA Specialist Teaching Hospital, also my teacher. And it's an honor to have him every time come here to share with us his wealth of knowledge. So, ladies and gentlemen, please help me welcome Dr. Joseph Okoeguale. Chief, good evening, sir.
Thank you, Fred. Thank you for bringing me on.
Yes, sir.
Thank
Welcome.
you.
Uh,
Yeah, yeah.
without wasting time, sir, I know you've been so very busy and you had to make out time for us today to talk about this very interesting topic. Now, I've had ladies ask me this question that they notice substances coming out of their breast. A lady tells me that I'm not pregnant and I notice, or I'm not breastfeeding, but I notice that whenever I press my breast, I see water or milk coming out of the breast. So I decided to have you as our guest today to please talk to us about this. What is it called and what does it really mean?
Oh, okay. I hope you can hear me.
Yes, I can hear you loud
All
and
right.
clear, sir.
Thank you very much. You see, breast milk discharge is a very common complaint from so many young girls and women. Young girls, older women and all that. So the complaint is very, very common. The discharge in itself is not really a disease, but it's just like a symptom that is manifesting from an underlying condition. And it's important to understand that in over 50% of cases, you won't be able to tie any cause to the discharge. The person is discharging from the breast, but you can't find the specific cause of the discharge. So that is just on its own. And it's also important to mention that although it's a common complaint, a common symptom that you find in women, particularly in older women, women of reproductive age group, it can also be found in men, not just in women alone. You can have breast milk discharge in men, among men, and even in smaller children. You can have a very small baby discharging milk from the breast. But in majority of cases, you will find breast milk discharge among women of reproductive age group. And like I have mentioned, in many cases, in over 50% of cases, you will be able to find the cause of the discharge. For those you're able to find the cause, it could just be a physiological thing. Okay. When we say physiological, it actually means it's something probably related to or not related to a particular disease. It can be something that is cyclical or something that happens just at that particular time from, some hormonal changes, in the body of that individual, not necessarily due to a disease. For instance, excessive stimulation of the breast during sexual intercourse could cause some form of discharge. It doesn't mean that there's an underlying disease. Excessive stress, when the lady is so stressed, so stressed, you could have milk discharge. When the breast is overtly stimulated during intercourse, sometimes you can have that. And sometimes there are some kind of dresses you will wear that will click on the nipples and all that. You keep having, you have some form of discharges. And even sometimes for girls who usually do, who are common with checking their breast all the time, they can press it so much, have some level of stimulation, and then you have some level of discharges. And then outside that, you could actually connect it to certain problems, not necessarily problems, to certain conditions. For instance, people who are hypertensive and are on certain medication, there are some medications you can be taking and then you start having breast milk discharge. Some antihypertensive. A commonest one we know is Aldomet. We know alpha methyl dopa, just as common as it is. You know, it could be one of the precipitators of breast milk discharge. Some drug that we take to cure depression or to allay the problems of depression, some benzodiazepine, even diazepam, Valium, and some other drugs can induce some form of breast milk discharge. Many antipsychotics can induce breast milk discharge. There are some herbal concoction that people will miss and take, and then it starts causing breast milk discharge. So just the discharge could result from certain things you're actually doing. Not necessarily that you have an underlying disease that is causing you to have it. But in some cases, you could actually have some diseases that are causing the breast milk discharge. The common one you may have is you may have some space occupying lesion, some brain tumors, some tumors in the brain. You know, some tumors in the brain that, you know, some may be very small, some may be very big, particularly occupying the pituitary area. We call them microadenoma. You know, outside that you can have some breast masses, some breast swelling that could cause some of these conditions that will lead to breast milk discharge. But don't forget the common ones. Pregnancy can be a cause, you know, a physiological cause of milk discharge. That's why when you are evaluating these women, you must be sure that the woman is not pregnant. That's even why Galactorrhoea is defined as, you know, expression of breast milk in a woman who is not breastfeeding. The woman is not lactating, she's not breastfeeding, but the milk keeps coming out of the breast. That's actually what the term refers to. If the woman has a baby is breastfeeding, then you don't need to bother what is actually causing the woman, you know, to be lactating. It's when the woman doesn't have, it's not, you know, breastfeeding, it's not trying to express breast milk for any reason. But you see the milk coming out. And that's why in very young girls, very sexually active young girls, the commonest, you know, way usually, no, it may not be so much. Usually when they are having foreplay with their partners, and probably, you know, the partner, it may not be, it may just be mild discharge from the breast. The partner playing with the breast and probably, you know, putting the mouth on the breast and all that. They'll come back with just and tell you that, you know, the man may start complaining. The spouse may start complaining. The boyfriend may start complaining that, you know, there seems to be something coming out from your breast. You know, that is really the first time. Because, okay, let me even check and see what level, what amount of fluid is coming out from this breast. And that's how many of them will get to know. And they will get so worried when they come to the hospital. So it's important to let them know that it's not always due to a disease. And oftentimes, even some of them could just go on their own without having to do so much about it.
Oh, thank you, sir. Because there is this fear from ladies whenever they notice there is a discharge from the breast. You hear that, would I be able to get pregnant? Or the reason why I'm not getting pregnant is because I'm having discharge from the breast. Is there any relationship between milk coming out of the breast and the inability to get pregnant?
Oh, okay. All right. Inability to get pregnant um, could be precipitated by several factors. There are many factors that could probably make or cause a delay or, affect the chances, of a woman getting pregnant. We have some female factors, we have male factors, you know. But sometimes the downside of breast milk discharge is that it may affect the regularity of ovulation of some of these females, and then causes what we call anovulatory circles. Circles that the woman don't ovulate, and of course that will lead to what? Circles that the woman don't ovulate, she will definitely not be able to get pregnant. So it can be a contributor to anovulatory infertility. That is why when we usually advise that if you notice you're having discharges from the breast, it's not something that you just wish away like that. You have to still come into it, particularly when you are desirous, you are married, you are desirous to get pregnant. You need to come to the hospital, see your gynecologist for proper review. The focus is not just on the breast milk. If a woman is having difficulty with getting pregnant, and you are seeing a gynecologist, the gynecologist will not focus alone on just that breast milk discharge. Of course, it can be a contributor. And it may just be one of the easiest thing for your doctor to actually manage. But it can also coexist with other factors. Who tell you that you know you having breast milk discharge, you're not having a partner with abnormal semen parameters, with poor semen? They could coexist together. A lady may have breast milk discharge and have bilateral tuber blockage. So which is worse? Is it just the breast milk discharge or the tuber blockage? So irrespective, if a lady has been trying for a period of at least 1 year and is still not able to get pregnant, it shouldn't just be tied to the breast milk discharge that the lady is probably having. It's always important to look at all other factors, both the male factors and then those female factors that are associated with it. There are many factors. Check for factors that may be responsible for anovulation, do the hormonal profile, check the prolactin level. Outside that, there are certain tests you do to assess the patency of the tube, to be sure that the tubes are open. You are doing your pelvic scans and other scans to be sure that there are no coexisting masses, no coexisting fibroid, and then many other things you may need to do. You may then do some ovulation to check the ovarian result depending on the age of these women. And then don't forget to investigate the male. Don't always be looking at the side of the women. Male factor infertilities are becoming more. Men are contributing more to difficulties with getting pregnant. Men are contributing more currently. Men are exposed to so many risks currently. And, there are some few studies that are currently available that many men, if you go to fertility clinic, where you have infertile couples coming into the clinic for, evaluation to check for the cause of their inability to get pregnant, you see that a couple of them, close to 40% of the men, have some form of sperm abnormality. So you have to take it very seriously and not always looking at the side or the part of the women in that aspect. That being said, the galactorrhoea, the breast milk discharge, could be a cause of anovulatory infertility. And if there are no underlying pathology, it can actually not be too difficult to manage.
Thank you, sir. For those who are just coming, Dr. Joseph Okoeguale consultant obstetrician gynecologist, talking to us tonight about milk discharge in a woman that is not breastfeeding. So many ladies tell you that I see milk whitish discharge come out of my breast, yet I'm not breastfeeding. So that is what he's talking about tonight. He has explained what it is. He has talked about the causes. Now, I want to ask, sir, let's say there is no obvious pathology. Is there any home remedy? Is there anything a woman can do at home? Maybe this question, a lot of people don't like coming to the hospital. Is there anything she could do in the meantime to see, oh, if this does not subside, then I need to present to the hospital?
Yes. The first thing is when a woman experiences that beginning to have breast milk discharge, it's important to take that decision, to take the steps to actually visit a doctor. That aspect is very important. But you see, there are certain things the lady must, the woman must also look at. You have to go back and review certain things. First, if you're on some certain medications, like we mentioned earlier, you must look at them and say, okay, this may be connected to this problem I'm having. Even some family planning drugs will actually be a cause of breast milk discharge. So you must look back and see what are the things I actually do. What are these things that, I feel that probably may be a cause of what I'm having. That's one of it. And then those kind of foreplay, like, that lead to excessive breast stimulation, which is difficult to control. You can't control the way people have sex in this life. Sex is meant to be enjoyed. I don't know why you will not start controlling the way you start having it. So that aspect is actually very difficult to control. But in those who already discovered that they are having breast milk discharge, we just advise them to minimize the rate of breast stimulation, particularly during sexual intercourse. And then there are certain clothing that you wear that in which you have to stimulate some areas of your breast and all that. We also encourage them to avoid wearing those kind of clothes. You also wear tight-fitting bra. Some of these bras that will keep the breast very tightly, very tightly to the breast. The common thing you have now is that most girls don't even wear brazier again. If you go out, you see that you get to campuses and all that. They feel freer not wearing some of these things. But some of these ladies who are having such complaints, it's important they wear that, and then properly they can examine their breasts themselves to be sure that there are no other things. They may have breast swellings. They may also have breast swelling, which you have to be sure, because we encourage people to do self-examinations and all that. They must be able to do that. Then the other few things they can do are basic investigations they can do. Basic investigations. Once you are having cycles that you don't menstruate, it's possible that you may not also be ovulating in those cycles. And if you now start having breast milk discharge in those cycles, it's important that at least you have a pregnancy test done. Just be sure that you are not even pregnant around that time. It's also very important, because that's a differential. That's one of the differential of this, complaint. So you have that test done. And then it's a swab from the breast. Some of the discharge can also be taken to the lab to actually check what it is, and at least a breast ultrasound scan. If you're able to do breast ultrasound scan, it may be able to tell you whether there's a breast lump or not, a breast mass, because that's actually your fear, to be sure that there is no underlying problem that's causing the breast milk discharge. And there are different kinds of discharge. If it's just normal milk discharge, it's really not much of a problem. When you begin to have bloody discharge from the breast, or yellowish kind of discharge, some discharges are clear and all that. That's even when you begin to worry. If it is milk discharge, I can tell you is usually not much of a problem. If it's just clear milk discharge, because many breast cancers and all that most of the discharges may present as yellow discharges or bloody discharges, so that's some of the common things that you will have. But basically, when you notice you are beginning to have breast milk discharge, it's important that you approach the hospital for complete check, for complete breast examination. The doctor is going to do a complete examination for you, from the head to the toe, complete physical examination, complete systemic examination. There are some signs that may indicate that there may be other problems, particularly when there's a coexisting brain tumor, when there's visual blurring, a person who keeps having persistent headache, then you have visual disturbance, visual blurring. Those are just signs that possibly that the person could have some space occupying lesion, a microadenoma. Then the level, when you get to the lab and you do some prolactin assay, because prolactin and serum prolactin is one of those hormones that stimulate milk discharge. So when the prolactin level is excessively high, it usually indicates that something probably is causing that level to be high. Some people can have normal prolactin level and still have breast milk discharge. You have those kind of people. They are prone to having breast milk discharge. With normal lifestyle modification, they will be able to control the level of discharges. Usual prolactin level may not be more than 35 nanogram per mil. But when the level is approaching 200, it actually shows that there may be a very small lesion called a microadenoma around the pituitary area. Bigger tumors like macroadenoma we give rise to levels that are over 1,000 nanogram per mil. So the higher the value, the higher the chances that there may be an underlying pathology that's probably causing that breast milk discharge. So one of the common tests that can be done is to get into the lab and check that prolactin level and see, if it's within normal or if it's becoming, abnormally elevated.
Thank you very much, sir. Welcome. For those that are just coming, tonight we are talking about galactorrhea, milk coming out of the breast. So you mentioned prolactin briefly. I know ladies who are currently on treatment for hyperprolactinemia, and there is this complaint that they keep having. This question they keep asking: how long would I be on medication? Because sometimes they are placed on medications to help them control or manage hyperprolactinemia. So within the range, how long should this lady prepare her mind to be on medication? Is it just based on the value of the prolactin? Sometimes it could be so difficult to come down, or could take her a long time, 6 months, 1 year, or less than that.
It's important to mention that there are medications that are used to control the level of prolactin, which will help to reduce the level of that breast milk discharge. Yes, that usually depends on some factors. Now, the prolactin level is important because sometimes in many gynecologists or many physicians, we prescribe the doses of some of those drugs at an escalating level. You don't just hit the person with a high dose at the start of the medication. You give a little dose and watch. You can do monthly serum prolactin level to monitor the level of the serum prolactin if it's going down, and then you gradually build up because it has its own side effect too. It has its own side effect too. But the problem with Galactorrhoea is that it is something that could recur. The level could go down now, and within few months, it start going up again. Except you're able to identify a particular cause and you're able to deal with it, exclusively. But we have mentioned before that in many cases, you may not be able to trace the cause. So the formula that many physicians will use will depend on the desire of that particular person to have a child at that particular time or not. So the formula a physician may want to apply for women who are desirous to get pregnant may differ from the formula the physician will apply in a person who is not yet ready to probably get pregnant. When the prolactin level is falling in women who are not desirous to get pregnant, the physician may decide to stop. But you see, some gynecologists will start some dopamine agonists, some of these drugs that are used for hyperprolactinemia, and just continue until the woman gets pregnant. While you follow up and monitor the level, because you feel that excessive level of the prolactin is probably responsible some of the anovulatory cycles that woman is having. The woman is not ovulating very well. It is distorting the amplitude and frequency of follicle stimulating hormone, luteinizing hormone, so you are not having proper ovulation. So you need to maintain that level over a given period of time until the woman eventually, gets pregnant. And you still follow up on the level. The level is very important, so that you don't also drag it so to a level that it becomes so low. It may have other metabolic side effects. So that's why that follow-up is again very important. And many will do some of this follow-up monthly to see the level of the serum prolactin. And the beauty of some of these drugs that are used. If there are microadenoma, there are small tumors in the brain. Some of these medications have the capacity to actually shrink these tumors. It reduces the size of the tumor so much that it may not require, surgery at the end of the day. So it's important. The medications are very, very important.
Thank you very much, sir. For those that have questions on this topic, if you want to ask Dr. Okoeguale questions on breast milk discharge outside of what he has talked about, please feel free to drop your questions tonight, and I'm sure he'll be glad to respond to you. We don't want to take his time. I mentioned some of the causes of breast milk discharge, and then talked about the treatments, talk about putting on tight bra for ladies that might be having this challenge right now. Sir, is there in the place of lifestyle modification that might also help in the management of a woman having milk coming out of her breast?
You see, for many conditions, they will tell you lifestyle modification is first. So for lifestyle modification is key to many conditions you have. In ladies, just try not to get fat. It will help so many things. It will help so many things, Part of it is this. If you don't have some of these conditions, it may not lead you to having certain things. Women who are obese are more likely to have hypertensive heart disease and are more likely to take some of these antihypertensive that could lead to what? Some of these side effects. It's also possible that women who exercise, who are free, are less likely to become anxious or get depressed, and now require some of these antidepressant, antipsychotics, which eventually will have some of these side effects that could lead to this. And then if you are also on a family planning device, family planning medications, it's important that you go for regular reviews so that you can be sure that yes, when you're having some of these side effects, salt cannot be modified to some that are very user friendly. Those are some of the things you can do, just basic things you can do. But the regular breast check is fine. Breast examination is fine, But when you do it too also frequently, you may experience it, but that doesn't. It's something we encourage. Breast examination is what we encourage, But when it becomes too frequent, it's possible that you may experience transient level. And then also, we also don't discourage those kind of foreplay during sexual intercourse, just because of the fear of having physiological breast milk discharge and all that, But they say that whatever you do it with moderation. So you just need to strike a balance between some of these things you do, and then if you notice some of these things, the earlier you present to the hospital, the better. If you also notice some of these cycles, it's important that at least you have a pregnancy test done and be sure that there's no coexisting pregnancy, that is underlying some of these things we are saying. And then for men, it's possible. Some men could also have some breast milk discharge. There are some men that have what we call gynecomastia. Some part of the breast tissues become raised, Oftentimes, some of these men have very low libido because the testosterone usually falls. For many men like that, they could have transient breast milk discharge. If a man has breast milk discharge, it's very important for that man to go for a full check of the breast. Because if you notice any breast swelling in men, the chances of that swelling being malignant is very, very high. So that is very important. If you find breast discharge in neonates, children that are just born, there's really no cause for alarm. Oftentimes, it's due to the transfer of some of the hormones of the mother, from the mother to the baby during the time of pregnancy and just during the time of birth that causes some of those things. And within few months, it usually abates on its own. We don't have to do months for it to return. We don't have to start giving drugs for it to return back to, the normal state.
With regards to these neonates, I've seen mothers who begin to apply heat compress. They begin to apply heat over the breast of their baby when they see the discharge coming out of the breast of the baby.
It really would do much, It's just allay their fears. I encourage them just encourage them that over time, to return back to, to normal. Just their normal state. Oftentimes, there's no cause for alarm in neonates. It's just that estrogen transfer from the mother to the baby that probably, except there are congenital factors, congenital brain tumors, congenital breast tumor that probably, if the child is well, is normal, there are no issues, you don't need to worry so much. You just allay the fears of the woman. That will be it.
So lastly, how often should a woman examine her breast? Because you mentioned you shouldn't do it too frequently so that you don't cause another problem. So how often should a woman examine her breast?
There's no hard and fast rule in breast examination. What many women do when they want to have their bath, they just, examine and then put a hand around their breast and check if their breast swelling and all that. But we encourage them to at least check their breast at least once in a month. You should be able to check your breast and see whether anything is growing in the breast. Sometimes when you check and check and check, you become more anxious, even with just regular normal breast tissue, you now begin to think that this could be, it's looking hard to do, it's looking like it's something is growing there. That's why we won't tell them to be doing it every day. By the time you do it today, you are doing it tomorrow, you are doing it the other day. I mean, it won't, be making more sense even to you doing it every time. So you can, develop that skill of doing a proper breast examination. But once or twice in a month is just okay to do a proper breast examination for yourself. You just do it and then you let it be. You don't have to do the breast examination every day.
You don't have to examine your breast every day, at least once or twice in a month.
You just have to.
Thank you very much. So we wouldn't want to take much of your time. We'll spend about 35 minutes tonight on this particular session. Would you have a final words regarding milk coming out of the breast for ladies? What advice would you want to give to them, sir?
Like I already mentioned earlier, breast milk discharge is a common complaint, not just in the gynecological clinic. It's one of the commonest complaint you will find in young girls, women of reproductive age, and among women who visit fertility clinics. And it could be associated with a lot of anxiety. Anxiety in the sense that, one, fertility potential, what they usually will come to you with is questions of, will this actually affect my fertility potential? How will this one impact on my ability to give birth to a child in the future? That's what younger girls will tell you. And then in fertility clinic, many of them will come to you and start asking you or telling you that, I think this is what is actually responsible for me not being able to give birth or not being able to get pregnant at this particular time. But it's important to understand that in many cases, there may just be no cause for alarm. That's one. There may just be no cause to worry yourself so much. But it's important that when you have it, you find that time, you try as much as possible to get a full check, so that you could benefit maximally from some of the medications that are used in taking care of this condition. It's not a condition that you need to worry about so much, because in many cases, they are not deadly conditions for women.
Thank you very much, sir. I don't know if anybody wants to contact you. How can they reach out to you, sir?
I was supposed to connect with my Instagram page because you went through this other link, and so you can help me pin my IG, my Instagram handle, Asking Joe. So asking_Joe. So if I have messages, I can always respond through my Instagram page.
Asking_Joe.
Yeah.
I think this
just asking_Joe.
Am I right? Is this
exactly? Right? I think that it is. Yes. No, asking. Okay. There may be no G. Yeah.
No G. Okay.
There's no G. Just Asking Joe. Yes.
Asking_Joe. Okay. So if you have a question, you want to contact Dr. Okoeguale, you can reach out to him on Instagram, asking ASKIN_JOE, and he'll be glad to respond to you. We appreciate you for your time today, Chief. Thank you very much, sir.
Thank you very much.
Thank you very much, and have a wonderful evening, sir.
And you too. Thank you.
Thank you, sir. Take care and bye-bye, sir.
Yeah.
Okay, thank you, everybody. Rekiat, Jubril, I see you all. Thank you. So this was a very short session. I spoke with Chief, and he decided to come to us tonight and talk about this very interesting topic. I hope for those ladies who have this complaint, you have gained one or two. You can watch this video again to know why you are having milk coming out of your breast. or discharge. Dr. Joseph has spoken a lot about it. So I'll see you all. Remember, good life now waiting. Good life. In that sense. Bye bye.